We are covering a critical topic for your phlebotomy certification exam, hemolysis. Understanding the causes, visual identification, and impact of hemolysis is absolutely essential, as questions regarding specimen integrity are a major component of the test. Hemolysis is the breakdown or rupture of red blood cells, which causes their intracellular contents to be released into the serum or plasma. On the exam, you'll need to recognize this visually as a sample with pink to reddish tinged serum or plasma. Let's break down the common causes of hemolysis, framed exactly as you might see them in an exam question. First is improper handling after collection. The test will present a scenario where a phlebotomist vigorously shakes a lavender top tube to mix the anticoagulant. You must identify this as an incorrect procedure. Tubes with additives should be gently inverted, not shaken. The physical trauma from shaking is a primary cause of red blood cell rupture. Another major cause is a traumatic venipuncture. An exam question might describe a difficult draw, perhaps on a patient with rolling veins, where the phlebotomist has to probe excessively with the needle. This mechanical destruction of cells by the needle bevel is a classic cause of hemolysis. The key takeaway is that any excessive needle movement under the skin can damage the cells. Equipment selection is another high-yield area for hemolysis questions. The exam loves to test your understanding of needle gauge in relation to vacuum pressure. Imagine a question that asks you to select the appropriate equipment for drawing a full panel of tests on an adult. If one of the options is a very small 25-gauge needle paired with a large 10-milliliter vacuum tube, that is a red flag. Pulling blood through such a narrow needle with strong vacuum pressure creates a shearing force that literally rips the red blood cells apart. This mismatch is a frequent exam trap. Similarly, prolonged tourniquet application is a test favorite. A question might state the tourniquet was left in place for 3 minutes. You must know that any application longer than 1 minute can cause hemoconcentration and also lead to hemolysis. Finally, don't forget pre-analytical errors before the stick. If the alcohol from the prep pad is not allowed to air dry completely before the needle is inserted, some of it can be drawn into the sample, acting as a chemical agent that lyses the cells. It's a detail-oriented point that the exam uses to separate prepared candidates from unprepared ones. Extreme temperatures, such as placing a fresh sample directly onto a frozen cold pack, can also cause thermal damage leading to hemolysis. Now, how does the exam test your knowledge of the consequences? The most important thing to remember is which lab values are falsely elevated. Red blood cells are packed with potassium. When they burst, all that potassium floods the serum. Therefore, the most critical analyte affected by hemolysis is potassium. The exam will give you a scenario, perhaps stating the lab rejected a sample for a cardiac patient due to a pinkish serum, and ask which result would be dangerously inaccurate. The answer is always potassium. Other affected analytes you must know are LDH, or lactate dehydrogenase, and AST, aspartate aminotransferase, which are also abundant inside red blood cells. When a sample is hemolyzed, the only acceptable action and the correct answer on your exam is to reject the specimen and request a recollection from the patient. You never report the results, even with a disclaimer. To help you remember the most critical affected lab values, use this simple phrase: hemolysis kills lab data. Kills can help you remember K for potassium, and the L and D can stand for LDH. If you can just remember that hemolysis falsely elevates potassium, LDH, and AST, you are well on your way to answering these critical questions correctly. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.